Firstly, what did you make of the announcement to scrap the independent assessments?
It's a fantastic announcement, and it's something that participants have been calling for ever since it was even considered.
Yeah, and also Prime Minister Scott Morrison's announcement yesterday regarding COVID vaccines being strongly recommended but not mandatory for disability workers. And also the government looking to perhaps incentivise vaccinations to attempt to boost vaccine rates. What are your thoughts on yesterday's announcement?
I think it's important that people supporting those with compromised immune systems or anybody who's vulnerable in the community right now take steps to protect those people. So I think it is good that providers encourage their staff to be vaccinated. But of course, as we know, it's individual choice, so we can't enforce it.
Yeah, absolutely. And not all people can be vaccinated, but it certainly is, well, we're seeing the evidence in terms of people not gaining the COVID disease and going into hospital. Now, you run an in-home disability support program for children on the NDIS, Leor. Tell us about the organisation and what changes are you hoping to see?
So, yeah, we deliver two streams of services. One is childcare for people who can't access mainstream services, and that can include people with compromised immune systems. And the other one is NDIS support, and that's predominantly early intervention services for children under the age of 6. The changes that we're seeing is really great in terms of early childhood. There was a recent announcement by the NDIS that families can now get access to early childhood supports without needing a diagnosis. That means it's removing a barrier to access for families, and we know that they're often running around trying to meet appointment deadlines, trying to keep their job, and also juggling the grief and the trauma that comes with the diagnosis. So to be able to simply go to their GP and discuss any concerns they might have about their child's development and then have access to funding under the NDIS is a fantastic announcement.
And what would you say to parents and carers, Andrea, who perhaps are sensing something may need to be looked at, but perhaps are afraid of the stigma or just a little bit apprehensive? What are some of the signs and symptoms to look out for?
So one of the really significant ones is where your child may regress. So, for example, they might have developed certain language skills or gross motor skills, and then after a while they actually lose some of those skills. So it's important then to talk to your GP or see a developmental paediatrician to discuss that. And then the other thing is simply compare it to your friends and family who have similar age children and look at whether your child's development is on par. And don't be afraid to talk to someone. This is the best time to support your child with their development because their brain is still developing, and we can achieve a lot through early intervention and get them on par, even if they're slightly delayed, even in just one area.
Yeah, you're absolutely right in terms of early intervention. You're also a national organisation, but with the current lockdowns, like for the one we're experiencing in Greater Sydney at the moment, what are your main concerns throughout the pandemic?
For us, it's about people knowing that services like us exist. So not just trying to juggle work-life balance while having children in the home, that you might be able to get access to the childcare subsidy for in-home care, or if you're on the NDIS, you might be able to get support workers through a service like us or higher up, and also use early intervention services in the home through services like us, or even occupational therapists or speech pathologists who come to your home. So don't be afraid to continue to support your child with early childhood education or development just because of the lockdowns, because services like us are actually allowed to continue to deliver services.
And Andrea, without taking away, of course, the devastation COVID has created with the upheaval of lockdown and online learning, do you have a case regarding the importance of personalised learning? I mean, we're seeing so many people learn differently, not just in the classroom. Is this really helping your case?
Yeah, definitely. And especially for these children on the NDIS, because what we do is we develop a holistic learning program. And what that means is we're essentially working with the family, with their therapists, with any other health professionals that the child is working with. And we develop an early learning program that considers their NDIS goals. So it's a totally tailored program. And we are seeing fantastic outcomes. So we've had children who have been on the NDIS for 18 months before they come to us, and then within 2 to 3 months, we're achieving their medium and long-term goals. And we are so proud of this, and I've actually spoken to staff in Minister Reynolds' office, and they're really impressed by what we're achieving, because it means that children might be coming off the NDIS earlier and therefore reducing the impact on the federal budget.